Hi, my name is Kelly, and I'm going to talk to you today about total knee replacements. Did you know that according to the National Library of Medicine, almost 14 million people in the United States suffer from knee osteoarthritis? What osteoarthritis is when the cartilage wears down in the joints and the bones are rubbing together, which can cause very painful and debilitating knee pain. This number has been increasing a lot because of the obesity rising in this country. Would you go to the doctor for knee pain, or would you just let it go? I work for an orthopedic surgery center, and I have a lot of patients that come in that have let their knee pain go for years and years. And once they come in, they're at a point where they can barely walk. Once we get x-rays on them, the doctors are astonished about how they're even walking. And then we go into talking about, okay, well, we should schedule you for a total knee replacement. Now, the process for this is some insurance companies, you have to get a referral for it. Some insurances, you can just make an appointment to come in. I would recommend researching orthopedic doctors that you might want to go see. Once you go in, you're going to get x-rays usually first. Then you will sit with the doctor and discuss your symptoms. The symptoms, according to the Mayo Clinic, is locking and catching of the knee joint, pain, obviously. You can have some swelling. And once that's all done, the doctor will do a physical exam on you. And then if you agree, we will start the process of scheduling your surgery. Once you're done with the doctor, medical assistant will come back in. Medical assistant will give you the necessary paperwork to fill out, which is a risk assessment for surgery. Kind of talk about to make sure all your medications are updated in our system, and then I will give you soap that you will wash with for 5 days prior to the surgery. Give you a physical therapy referral after a knee replacement. You will be starting physical therapy a day or two following, which is quite shocking for a lot of people because it is a very painful surgery. After that, the medical assistant will leave the room and we will send in a surgery scheduler. That surgery scheduler is going to go over any health history. If you have any heart problems, you'll have to get EKG. If your BMI is over 40, you will be told that you need to get it below 40 and then come back in 3 months and we will do a weight check. If you use any sort of nicotine products, you must be completely nicotine free for 6 weeks, about a month and a half. We determine this with a blood and urine test. So if you come in and say, okay, I've been nicotine free for 6 weeks, and you go get your blood test a few days before surgery and it's positive, your surgery will be canceled completely. And then you have to wait another 6 weeks. So a few days before your surgery, after you get your surgery date, you will be called with a check-in time, when to stop eating and drinking the night before, and then you will show up for your surgery. Most people are going to be going home the same day unless you have some other health issues. You might have to stay overnight in the hospital. After your surgery, you will go home. You will begin physical therapy. There is a lot of protocols to look out for during your post-operative care. You want to look out for any redness, swelling, tender spots on the leg, because that could mean that you possibly have a blood clot, and then we would have you come back into the hospital and get a Doppler ultrasound to rule out a blood clot. You do take aspirin for 4 weeks after surgery, so that usually clears up any sort of blood clots. After your physical therapy, you will come in 2 weeks after your surgery and see a physician's assistant. Following that, you will come back after 6 weeks and you will see your surgeon. And we basically check for a range of motion, infections, and make sure that everything is properly healing and that you're able to walk. Most people following this surgery, after the painful couple months, are so happy and living their best life. They have a new knee. So my question for you is, after hearing all of this, if you were suffering from knee pain, do you think that you would go in and get it checked out and possibly get a brand new knee? Or do you think that you might let it go? Thank you for listening, and have a good day.